Is nightmare disorder hereditary? Have you ever woken up in a cold sweat after a vivid nightmare? You are not alone. Many people experience nightmares, but what if I told you that genetics might play a role in how often they occur? Research indicates that nightmare disorder does have a hereditary component. This means that if someone in your family has frequent nightmares, you might be more likely to experience them too. Studies involving large groups of individuals, including twins, show that genetic factors account for about 36 to 45% of the variation in nightmare frequency. This suggests that while genetics are important, environmental factors also play a significant role. Interestingly, genome-wide studies have identified specific genetic variants linked to nightmares. For instance, variants near the genes PTPRJ and MYOF have been associated with how often people experience nightmares. These genes are connected to sleep regulation and brain function, hinting that nightmares may be tied to biological mechanisms that affect how we sleep and process emotions. Nightmares are not just random occurrences. They often correlate with psychiatric conditions such as depression, anxiety, post-traumatic stress disorder, and insomnia. The overlap between nightmares and these mental health issues suggests that nightmare disorder may share common biological pathways with them. From a sleep wellness perspective, understanding the hereditary nature of nightmare disorder is essential. It highlights the need to address both genetic predispositions and environmental or psychological triggers. Improving sleep quality, treating any coexisting psychiatric conditions, and working on emotional regulation can help reduce the frequency and impact of nightmares. There are practical steps you can take to manage nightmares. Maintaining a consistent and healthy sleep routine is a great start. If you find that nightmares are frequent or distressing, seeking professional help is important. Family history can also be a part of sleep assessments to better understand your individual risk. Behavioral therapies, such as imagery rehearsal therapy, can be effective, especially when nightmares are chronic. This therapy involves rewriting the narrative of your nightmares to create a more positive outcome. In summary, nightmare disorder is influenced by hereditary factors, but it is also closely related to sleep quality and mental health. A well-rounded approach that considers genetics, psychological health, and lifestyle choices can be effective in managing nightmares.